Over the last 3 decades, the organization has grown to shape the health products and technologies supply chain in Kenya and the wider Sub-Saharan region. This has been done through providing reliable, quality, affordable products to a large clientele in Kenya and beyond. MEDS offers health system strengthening programs for health workers and quality testing services to clients spread over 20 countries.
MEDS was founded in 1986 by the initiative of Reverend Juan Divani, who saw the need of supporting faith-based hospitals so as they could have access to quality drugs. And so we want to thank God for the milestones so far realized. And in view of those milestones, we actually are thinking of how to continue growing this organization to greater heights. Yes, it has scaled the height of drug supply, but we are still thinking of how we can continue to grow it so that we can sustain the momentum of the good work that was started then.
Right from the foundation, the focus has been the faith-based health facilities. When you look at Sister Joan, when she was founding this organization, the focus was how best to help the church-based or faith-based health facilities to provide medical care and possible equipment so that it can aid the church in its mission.
Well, MEDS is a very key institution in the health sector. So it has several roles, critical roles that it plays and that work towards complementing the government vision of universal health coverage that has proven to be an efficient, reliable supply chain organization that is able to serve the entire country.
As MEDS, we have 3 core mandates: medical supply chain and logistics, where we procure, warehouse, and be able to distribute to health facilities. This is a purpose-built warehouse. Pharmaceuticals and medical devices have to be stored in very stringent, some very regulated environment. We actually have to adhere to some standards. We talk of good distribution standards or good distribution practices and good storage practices. We have WHO standards and we even have local standards that are set by the regulator, the Pharmacy and Poisons Board. So to have such a warehouse, it has to be inspected to be meeting those particular standards. This warehouse has actually been built to meet those standards. We're even warehousing for donor-funded projects, key among them being the USAID. We are currently running a program that is called the USAID Dawa za Ubora project, where we are distributing to all the counties in the country for products to do with HIV, malaria, TB, issues for maternal and neonatal health, and other commodities.
One of the strengths I can say in terms of MEDS is about our quality assurance and health system strengthening. Because remember, we say that we pride ourselves of quality, because even the most vulnerable require quality services, quality health products and technologies. So in terms of the testing, we are able to ascertain that we meet that threshold.
Throughout the last 27 years, we have seen the lab grow. The lab was inaugurated in 1995. The capacity then was only to do physical-chemical testing. So the microbiology element was missing.
Which means that there's a certain range of tests that we are not able to do in-house. So in terms of enhancing our capacity and ensuring now we can do the whole range, it was felt important then to expand and ensure that we also have a microbiology unit.
Microbiology testing and physical-chemical testing definitely complement each other. For oral solid dosage forms, where you have your tablets and your capsules, majority of them just require physical-chemical testing, so for which we had the capacity. although there are certain requirements, there are certain times when, especially you're doing an investigation or an analysis, then you may want to go a step further to conduct microbiology testing on those particular products. But mainly for compliance testing, physicochemical testing is sufficient. The lab serves as a very, very important tool for quality assurance. We test our medicines just to make sure that they meet the desired quality requirements.
Microbiology laboratory is a very sensitive area that is controlled. So precautions should be taken when entering the microbiology laboratory.
We have the best personnel to be able to manage operations, not just within our physicochemical lab, but also within the microbiology lab. The entire lab is automated. So we have equipment that is able to send data directly into an automated environment in a real-time manner to be able to give not just efficient results, but very accurate results.
I can be able to access this data wherever I am so that I can be able to review what is happening. So any reviewer can review, but the fact remains that you have to access the system using your user password.
We collaborate a lot with the Pharmacy and Poisons Board in regulation, and I am sure this facility will come in handy to aid their efforts, their regulatory efforts in keeping the country safe.
The laboratory has two different areas. We have the non-classified control area, like where we are currently. This is an area where the temperature, humidity, and the pressures are controlled. So there is an air handling unit that handles and controls the environmental condition within this region. But we also have control areas. This area, this end, starting from here to this end, is a clean area. So that means that is a classified area with clean air inside, so the temperature and also the pressure differentials, and we also have the microbial contamination in that clean area is controlled.
We use MEDS as a reference laboratory to get results whenever we find suspicious medicines in our network. It is very important that MEDS can do a full pharmacopoeial analysis on these suspicious products, and that we get all the details and that we're able to report them internationally.
We only have 9 WHO labs in Africa, MEDS being one of them. The benefit basically even extends just beyond this country alone, but we also look at our neighbors and the entire continent, which can benefit from using such a facility to assure quality of their medicines.
MEDS is one of our member drug supply organizations. EPN is a network of 139 members. Among them, we have Christian Health associations. We also have drug supply organizations. And MEDS is our best, well-developed and well-performant drug supply organization. It's for us a center of excellence where we bring other drug supply organizations to learn. We use the expertise of MEDS. There are different staff in all our engagement with members.
MEDS, we pride ourselves in terms of some certifications, which are very, very key, and that's why we are very unique in the market. One of the greatest certification is ISO. We've got ISO 9001 2015 certification in terms of quality. We have also WHO pre-qualification in terms of quality control laboratory, so that we are able to do testing, so that whatever we are selling in terms of health products and technologies which are going to the market, and especially to the patients, they have been able to meet certain quality thresholds, so that we can be able to have improved clinical outcomes when the patients are treated. Then also we have got another certification which is very key, we call DG ECHO. This is the Recognized Humanitarian Procurement Center, and this one is based on European Civil Protection and Humanitarian Aid, whereby we are able now to serve the NGOs, non-governmental organizations, both locally and internationally, and we have been serving them in several countries, whereby now they can be able to procure from MENS because you've been certified based on the issues of quality, and that one for the DG Eco. And the last one we have, which is also very key, is USAID, BHA, which is a Bureau for Humanitarian Assistance, and this is a pre-qualified Rosetta. So that's why you see that we are being engaged in terms of some of the donor programs related from the USAID, and even NGOs being funded, procuring from MENS at that level.
We've had a chance to basically test quite a lot of products. I'll put the number at about 25,000 plus since the inception of the lab.
We've seen products where turnarounds are fast. We get very quick response times from meds for all the products that we give. And for us in the trade, it's crucial for our products to be looked at, analyzed, looked at very quickly, because it impacts on your trade.
We are serving actually all the market segments currently within Kenya and out of Kenya in Africa, and also globally. And the other thing is about last mile delivery, which is very key, because we deliver to the doorstep and at no cost at all.
MEDS is an excellent channel for us because they do serve a channel that where we have limited penetration. Some of the counties, pretty much all the mission hospitals. So working with them gives us an avenue, a channel that we can supply through them. It also reduces certain logistical headaches that we have, because some of these hospitals are located quite remotely.
As a key strength is a wide catalog of products. We got from medical supplies, laboratory reagents, we got everything you need. And we normally say that you need it, we have it, because we have stocked everything, all the items.
MEDS and KEMSA are both Tier 1 supply chain organizations. We basically operate the same model. We have an essential medicines list, which needs to basically be available within the supply chain at any given point in time, to be able not to just serve the faith-based health facilities, but also the counties. So we collaborate a lot. I see a situation whereby together we have a combined pool of more than 90% of what we supply in the country. So KEMSA has actually used our facility here to be able to check the quality of their products.
In terms of advocacy, we contribute to policy development in the area of pharmaceuticals and supply chain, but also we are part of the bigger group of the Kenya Faithbased Health Service Consortium, which is proactively engaging in dialogue with the health sector, with the Ministry of Health, with the agencies like NHIF, now Social Health Authority, and other stakeholders in health.
We will not import any product that is being manufactured locally. In fact, going forward, where we have at least 3 manufacturers of a product, we should never import that product into Kenya. Let the competition between the players, the manufacturers in Kenya, is sufficient for us to get value for the drugs and the pharmaceutical products that we are looking for.
Growth and sustainability, I have just indicated the issue of special purpose vehicle. And one area of that special purpose vehicle is the area of manufacturing. So that's a key area that we want to explore.
We must align ourselves to the government plan. But as we align ourselves to the government priorities, we must add value. So we are adding value in terms of quality. We are adding value in terms of efficiency. We are adding value in terms of a structure that ensures that even in the remotest areas of our country, these services are enjoyed by the people.
We are now implementing a new strategic plan. Within the plan, we are talking about one of the key pillars. We have 3 pillars, but one of them is diversification, where we want to venture into more products. One of the recent areas where we've actually ventured into and are growing in it is the medical equipment. And then over and above that, we are looking at increasing the range of products that we do keep in our warehouse. So we are talking of 10,000 pallet spaces in this warehouse. But as we speak right now, we've already jump-started a process where we even want to optimize the spaces that we have. We want to even increase much more than that by being able to utilize various technologies like what I would call floor racking, for example. And as you can see, we have the racks. There's a way that you can interlink some of these racks. And we are hoping that maybe God willing, by the end of this year, we could actually talk of 2,000 additional spaces. So this will go a long way in being able to store more from our local manufacturers as we try to meet the demand of what we have within the country, the region, and even beyond. We are also looking at possibilities of even getting additional warehouse beyond what we have here. We have a branch in Kisumu where we also have some more additional items stocked there. Again, in our strategic planning, we see that as a growth area. We are thinking in expanding within that region. We have an ambitious strategic plan that is seeking to deepen our presence but also expand to new markets within and outside. We do this by marketing, getting ourselves known, by expanding our partnerships, working, collaborating with county governments, county health departments, and national government, donor partners, development partners who are involved in health, and other stakeholders. And what we appreciate with MEDS, they are always available whenever we need to work together to support the network. They are really coming in quickly, fast, to support all the initiatives which can help the church health system as a whole in Africa to improve their operations. What I'm very particularly proud of is the fact that we used the required WHO specifications for pharmaceutical testing microbiology labs to be able to design and build and come up with this particular unit. So I'm very confident when I say that it basically then meets the desired standards of a pharmaceutical microbiology lab. Given that we are operating at WHO standards, what I would call international standards, then I think we can be able even to give better assurance to ourselves for what we stock and distribute, but also to those who come knocking on our doors for testing services, to do all these in one place. We definitely see them as a valuable partner, both from a supplier perspective and from a customer perspective on our side. Quality assurance is really a must and should not be neglected. And MEDS is really pacemaker, I think, in that. MEDS is at the top in our network. It's really simple because MEDS has done a lot to improve not only the supply of medicines, but also the quality control. We are at a position that we should say, with the support that we are giving as secretariats, then this is a sure strategy that we can come to.
MEDS has a track record of that 7 years. The customers we have worked with, we have never failed them. And we want to assure you, Kenyans, the good work that we have involved ourselves in will continue with that spirit. And so you can trust us, you can try us, because we have been tried and tested in the past. And so we are there to serve you.